Hey guys, this is Dr. Abhishek. I'll be covering all the short subjects first. So, starting off with anesthesia. Let's talk about the brief introduction first of all of anesthesia. It is defined as loss of physiological reflex response to the stimuli provided by anesthesia for surgery with or without the loss of consciousness. So, the loss of consciousness is not important, does not necessarily occurs in case of anesthesia. So it consists of a triad, that is analgesia, amnesia, and the muscle relaxation. So when we talk about the triad of general anesthesia, that is GA, amnesia is replaced by hypnosis. That is the only difference. So basically you're asked about this triad only, about the triad of anesthesia. So you have to remember analgesia, amnesia, and muscle relaxation. Now, one important point to note is that bradycardia is not the part of the triad. So this is a general question that has been asked in the exams. Okay. So if we talk about the history, I don't want to stress on every single fact over here. So it would be better if you could take a screenshot or make notes of these facts. It would be much better. So all these points are really important, but I think you can focus on the two important points over here. First is by W.T.G. Morton. W.T.G. Morton was actually the father of modern is actually the father of modern anesthesia. Okay, and he was the first person to publicly demonstrate ether anesthetic. So and one more point about John Snow. John Snow, who knows nothing, but maybe he knew how to write a book on anesthesia first. So he was the first person to write a book on anesthesia, right? I know it was a poor joke, but still. So the father of anesthesia is John Snow, and father of modern anesthesia is W.T.G. Morton. And one important point to note is that World Anesthesia Day is celebrated on 16th of October. Right. Now moving on to another important topic, that is pre-anesthetic checkup, or PAC. This is how we call it. In case of PAC, we we stress a lot on the respiratory system, the cardiac system, and the airway of the person. Right. So we've got an ASA grading, that is American Society of the Anesthesiologists. This is meant to assess the risk and the physical status of a patient. Okay, so we've got 6 grades in all. We'll be discussing the grade 1 first. This is basically a normal, healthy patient. So if a person is normal, healthy patient, you'll grade him as grade 1. Okay, you'll categorize him as grade 1. Now, grade 2, the person has a mild systemic disease, right? And but that mild disease is well controlled, right? There is no functional limitation in case of grade 2. So still the person is fine. That means there is no risk in giving anesthetic to the patient over here. Third grade is the moderate systemic disease. Okay, the person has some moderate systemic disease and he has got some functional limitation as well. The fourth grade, this person has a severe systemic disease. Okay, so here we have to be a bit careful while using anesthetics. So this person might be having unstable angina, AS, or diabetic ketoacidosis. So in these patients we have to be very careful. So this patient is in constant threat to the life of the patient. Okay, so this disease has a constant, this person we have to be very careful because there's a constant threat to the life of the patient in these cases. Okay, this is grade 4. This is very important. Remember this. Grade 4 means severe systemic diseases. Okay, and we have given 3 examples as well. Grade 5 means a moribund patient. This patient, he is going to die eventually. You can't help him with the surgery as well. This patient is going to die eventually. So even after even if you do the surgery or if you don't, okay, he's going to die within 24 hours. Now, 6th grade is basically a brain dead patient for organ donation. Okay, so these are 6 grades according to ASA grading, but this ASA grading has got some uh, drawbacks. We'll be discussing only 2 drawbacks over here. The first one is a major drawback. What is that? The surgical condition of the patient doesn't affect the ASA grading. For example, if the patient comes to you with meningioma, okay, he comes to you with meningioma with headaches, you'll categorize that patient as grade 1 according to ASA grading, because apparently he's normal, he's healthy patient, right? Still grade him as grade 1. But we have got some complications while doing any surgery over there. I mean, like whenever you're doing any surgery in the brain, there are some risks all the time, right? So whenever treating any patient with meningioma, you have got some risks, but those surgical risks won't be included in case of ASA grading, so the patient will be graded as grade 1. So this is not a foolproof grading, right? Second drawback is that it won't take into account the asymptomatic patients, right? So we don't grade them. I mean, like if a person is asymptomatic, we'll eventually grade him as grade 1. Now, coming on to the examination of airway, right? So examination of airway, basically we use the Malampatti grading over here. It's a very famous grading, you must have studied in the MBBS course as well. So Malampatti grading is basically used to assess the size of the tongue of the patient for laryngoscopy. So the tongue can interfere while doing the procedure, so we have to assess the size of the tongue. So we have got 5 grades over here. Don't confuse with the grade 4 as because grade 4 is the last grade. Don't ever think of it as consisting of only 4 grades. There are 5 grades in all, including grade 0. Okay, so grade 0 means that you can see the tip of the epiglottis. Okay, so this is grade 0. That means the size of the tongue is pretty small. Okay, grade 1 is that you can see the tip of uvula. You can see a tip of uvula. Grade 2 is that you can see the uvula, but you can't see the tip. Grade 3 is that you can't see the uvula. You can only see the soft palate. And grade 4, you can't even see the soft palate. So grade 3 and 4, these 2 grades, they're very difficult in case of intubating a person. Okay, so you have to be very careful. So before the patient comes to you, before you're giving any anesthetic to the person, you'll assess the size of the tongue by using the Malampatti grading. And if you see the patient falls in grade 3 and 4, you have to be either very careful or you won't give the anesthetic at all, right? But still, we have to be very careful regarding, I mean, like while doing the intubation of the person. I mean, like if the person needs intubation, we have to be really careful in grade 3 and 4. Now the second thing, we have discussed the Malampatti grading MPG. Second thing is thyromental distance. Okay, so again we are doing this just for assessing we're just examining the airway over here. I mean, is the airway patent or not? So that is what we're discussing. So the thyromental distance is basically the distance between mentum and thyroid. It should be more than 6.5 centimeters, right? The sternomental distance should be more than 12.5. Now there's another important thing called is the adequate mouth opening. So mouth, I mean, like the distance between the upper incisor and the lower incisor should be at least 3 fingers breadth, right? Only then we'll say the airway is patent. Okay. Movement of cervical spine. If the movement of the cervical spine is restricted, for say in case of ankylosing spondylitis, the movement of cervical spine is restricted. In those cases, we can say that the airway is not patent. Okay, we can say that. Now coming on to the management of pre-existing drug therapies, this I guess we'll discuss in the next lecture, in the next video. So please, if you have any complaints, if you have any suggestions, if you have any any suggestion regarding the language, if you want me to switch on Hindi as well, please do comment down below, right? Let me know if you want any kind of changes, if you want any change in pattern, any change in the way I am speaking, or if you want it to be more interactive. I don't know how you want to do it, but please do mention your suggestions in the comments down below. Okay, thanks a lot.